Hi, my name is Karen Townsend, and I'm the Director of Health at RCS and the School Nurse Consultant here. This is your sub-training on the medical procedures and the health office procedures for our students. First, I want to say that we have an incredible team at RCS. It's comprised of three of us, myself and two health techs, Jamie Evans and Jessica Zweep. Jessica works out of the elementary office. You would see her there if you were in the K2 building. But she also works over and floats over to the other side of the campus. And then Jamie Evans is the health tech that works directly in the middle school office. The reason that I bring this up is because we do have an incredible team, but it's really important that we use the right terminology as it relates to the titles of health staff. For example, when we send a student to the health office, we need to say that we're sending them to the health office, not that we're sending them to see the nurse. There are legal implications of a student seeing a nurse versus seeing a health tech. Jamie and Jessica are amazing. They're awesome. So I just want to make sure that you understand that there's only one nurse on campus, and that is myself. And we just have to be really careful about how we refer to staff who are working in our health services department. There's three of us, as I said, and you could see any one of the three of us, but we just have to be careful with terminology. Because it is important and actually has legal consequence. The other thing is, because our staff is so incredible, I want you to send kids who are not feeling well. If you have questions and you're like, I'm not sure if I should send this kid, or I'm not sure if they're sick or not, please send them. If you have any questions or concerns about anything that's going on with their health, we would rather that you always err on the side of caution and make sure that any child who has a complaint is seen by one of the members of our health team. We love to see the kids. We know so many of them, and we're not going to get annoyed or frustrated. When in doubt, just send them. The other thing that you will notice in your classrooms when you're subbing is an orange folder. That orange folder contains confidential health information for your students in your classes. So if you're high school sub, it would include all of the kids that you go through the day and see in the different periods. Same with middle school. And then if you are if you're subbing for an elementary student or an elementary teacher, then you would again have that entire class list. I mentioned this because your sub plans should include the orange folder. And so I would like if you could check that folder just so that you're aware of what's going on with the students. And you know, for example, this kid, especially in the younger grades, has a food allergy. This kid has asthma, something like that. So those plans are in the orange folders. They should be part of the sub plan in general. But you should have access to these folders, and it's definitely okay to ask. I've also trained the teachers, and they know that they're supposed to include the orange folders in your subplans. This also goes along with our orange folders, confidentiality. Please keep in mind that any student health information contained in the orange folders is completely confidential. Do not share that information with other students, with parents, or anyone else. We are not bound by FERPA, which is the law as it relates to education in terms of health information, in the same way that a public school is. However, we are still bound by certain parts of FERPA, especially as it relates to confidentiality. So please keep in mind that you are accessing private health information, and we need to be mindful that we are not sharing that information with anyone. Finally, as it relates to health and emergencies, you guys will have radios that you can use channel 1 on those radios to report not only a health emergency, but also anything related to security. If you have a concern about somebody on the playground who fell down, all you have to do is call for health services and just say, hi, this is so-and-so. I'm on the east playground. I need health services. It's simple as that. Please make sure that you're holding down the button as you begin to talk. So it would be a hold down of the button. Give that about a second. Talk on the radio. Release. Otherwise, you'll cut the first part of the message off and we won't be able to hear you on the health services side. Please keep in mind that if it is an emergency and you need help immediately, the radio is your best bet. We can get to anywhere on campus in about a minute to 90 seconds. But if you don't, we also don't want to use children's names or their medical condition on the radio. So, for example, you could say, health services, this is, and say your name. I have a student in the West Playground who needs assistance, but that's where I would like you to leave it. I don't want you to say they fell and broke their arm. I don't want you to say they're bleeding. They're unconscious, nothing like that. The reason for that is our radios operate on repeaters, and anybody with a radio can really hear our channels. So we want to protect children's health and confidentiality and their privacy by not relaying their name or their condition over the radio. Finally, this is important for everyone to understand. As a substitute, you are becoming a mandated reporter. Everyone in this room and in the school itself are considered mandated reporters. In the event that you have concerns about a student or they have reported something to you, your first step is to notify your campus administrator. And if you can't find an administrator, your next step would be to find me, the school nurse. Your administrator or myself will walk you through the steps of mandated reporting. We have a form that we use for reporting that has the questions that will be asked so that it's readily available for their report. But please keep in mind that a mandated reporter is legally required to report anything that was told to them directly by a child. So for example, if you were told that a child was getting hurt at home, for example, you would then need to not only report that to your campus administrator, but it would be your legal responsibility to report it to the CPS. Otherwise, you have not relieved yourself of the legal responsibility. So notifying an administrator does not negate the legal responsibility to report. That's just an important delineation, because so many times you think, well, if I notified the administrator, they're aware, boom, we're done. And please know that the administrator or myself will sit with you and walk you through the steps, including calling the number and getting the report number and all the things that are involved in making a report to CPS. Otherwise, we're happy to have you here. Thank you so much for being subs here at RCS. It's a wonderful school. It's a great community. And please feel free to introduce yourself if you see me walking around, or find the health office. Our staff is incredible, and I will see you around. Thanks so much. Take care.